So, in today's presentation, I am going to discuss case taking in homeopathy. Case taking is the foundation of homeopathic treatment. During the case taking, we will interview the patient and note down his symptoms. And there are various types of symptoms we will categorize. It is said that a well taken case is half cured. Case taking is considered as an art. Symptoms are representing the inner nature of sickness, and there are various types of symptoms. Patient comes with number of symptoms. Physician has to scrutinize those symptoms. So physician will categorize these symptoms. Physician will acquire the symptoms of patient. And why we give importance to the symptoms? Because they are the inner nature of sickness. So how to proceed for this now? The by the method of analysis of symptoms and evaluation of symptoms. What is analysis? Analysis of symptoms is identification, separation, classification, and naming of symptoms. So we are basically categorizing the symptoms. It is called as analysis of symptoms. And what is evaluation of symptoms? It is grading of symptoms according to their hierarchy or according to their importance. Patient tells the symptoms which are usually of the suffering part, organ or disease, or report spontaneously. These are considered as particular symptoms. So now we will see the basic types of symptoms. So the first type of symptom I am describing is the particular symptom. In this discussion, we are going to consider only three types of symptoms, that is particular symptoms and mental general symptoms and physical general symptoms. So in this discussion, we are going according to the Kant's view. So patient tells the symptoms which are of the suffering part, organ or disease. So if he says the symptoms of cough, cold, they are of respiratory system. If he tells the symptoms of nausea, vomiting, pain in right hypochondrium, he is suggesting the symptoms of gastrointestinal tract or maybe directly of the liver. So they are called as particular symptoms. These symptoms are common symptoms, particular symptoms, or pathognomonic symptoms or basic symptoms. These symptoms are important for disease diagnosis as well as selection of remedy on pathological basis. So if the patient complains of pain in the right loin, that is kidney region, and burning micturition, he patient is probably suffering from renal calculus, and we can select the remedy on these particular symptoms. It is called as organ remedy, say Berberis vulgaris. Now the homeopathic approach continues further in a way that we have already described the symptoms of disease, and now we see the symptoms of patient. So are the symptoms of disease not the symptoms of patient? It's not like that. They are also of the patient, but we classify them as symptoms of disease as particular symptoms, and symptoms of patients are called as mental generals and physical general symptoms. These symptoms are invisible. Patient does not tell on his own. These symptoms are of patient as a person. So patient does not tell these symptoms on his own. It is physician's skill to find out these symptoms from the patient. So to find its symptoms, which symptoms? Of course, mental generals and physical general symptoms is called as perceiving. And this skill of the physician to perceive these symptoms is the art of the physician. What is to perceive? To perceive means to see with the eyes of mind. So physician will be sensitive enough to perceive the patient's mental general symptoms and physical general symptoms. So we'll see subsequently what are physical generals and mental general symptoms. What are the examples? Now we already know what is evaluation of symptoms, nothing but grading of symptoms according to the hierarchy. So we have categorized the means the analyze the symptoms into three, that is physical general symptoms, mental general symptoms and particular symptoms. Now how to grade these symptoms? So how to grade these symptoms? Mental generals, physical generals and physical particulars. This grading we are going by Kent's approach. So for example, mental general symptoms, the most important in the evaluation we will be considering causative emotional modality. Say for example, ailments from grief, bad news, vexations, that is suppressed anger. So, or second will be causative intellectual modality. That will be pertaining to patient's will, motivation, and drive. Third important we will consider in the evaluation is aggravating emotional modality. So, say aggravation by company, aggravation consolation, aggravation by some fears, aggravation by anger. Okay. Now, next important we'll consider aggravation intellect. So, aggravation intellect, say some symptoms of memory, some symptoms of will. If there is any aggravating modality, we'll consider under aggravation intellect. Now, the next will be amelioration of emotional symptoms. Say better by alone, better by music. That is amelioration of emotion. Followed by amelioration of the intellectual symptoms. Say patient is better by, say, pertaining to the symptoms of idea, will, memory. So amelioration by intellectual symptoms. Amelioration of intellectual symptoms is the proper correct meaning of the evaluation. Next is mental state. So mental state will consider by describing the patient as he is irritable, submissive, suspicious, jealous, and last will be subconscious state. That is nothing but patient's dreams. So this is how we will consider the symptom and put in the hierarchy. These are the rules of evaluation which are very important. So given the case, say ailments from bad news is there in the patient's history, we'll take that symptom first. Second will be causative intellectual modality. Third is aggravating emotional modality. Fourth is aggravating intellectual modality. Fifth is ameliorating emotional modality. Sixth is ameliorating intellect modality. Then mental state. And last is subconscious state. Now, what are the examples of physical general symptoms? They are nothing but general modalities. So, general modalities such as what? If patient has fasting aggravation, sun aggravation, motion sickness, that will be considered as general modality. What are general sensations? So second important we will consider in the case that is general sensation. So that is say sensation of ball in the abdomen or bearing down sensation. Third important we'll put in the evaluation is a thermal state. Say hot, ambithermal, chilling. Next important we'll put as craving and aversions. That is patient say craves sweets or aversion to bitter. Next important we'll give to the menstrual history and sexual history. So modalities before, during the menses, sexual history, desire increased, desire decreased, or any modalities. Then we'll consider stool, urine, perspiration, that is the excretory products. Then we'll consider patient's build, sides, and spatial senses. So these are the rules of evaluation of physical general symptoms. Now, physical particular symptoms, how do we evaluate? We evaluate by taking concomitant first, then modalities. In the modalities, we'll take first causative, then aggravating, then ameliorating. Then third, we'll take sensation, and last, we'll take location. And these mental generals, that is MG, physical general, that is PG, and characteristic particular in together form totality of symptoms. So physical particular symptom, what is most important? Concomitant. Say example, thirst increased for sip of water during upper respiratory tract infection. That will take its first because it's always the patient symptom, not the disease symptom. Because disease symptom here is of the cough. Then modalities will first consider ailments from, say ailments from getting wet in the rains or exposure to sun, that is causation. Then aggravation, say staying alone or in the dark, that will be aggravation. And amelioration, say better by fanning, better by keeping windows open. And last we'll put as a location, say any system affected, respiratory, GIT, excretory. So this is how we form totality of symptom after doing analysis and evaluation. So selection of simillimum will be based on PQRS symptom, that is peculiar, queer, rare and strange. They are the characteristic symptoms. Always also we consider intensity of symptoms, LSMC, that is location, sensation, modality, concomitant, and sides of body for considering the remedy, that is nothing but our homeopathic simillimum. Thank you.